Hi, everybody. Welcome. Thank you for joining us. We're just going to let everybody join the call and we'll get going in a couple of minutes. Okay, welcome everybody. Thank you so much for joining us today. We're going to get kicking just because we've got an awful lot to get through, so we're quite tight for time. I'm just going to ask my fellow panelists, can you all see my screen? Yes, I'm getting some thumbs up, so that's good. Okay, so thank you so much for joining us today. Hopefully you're expecting to be here talking about AI in home care, top tips for smart and safe use. We are the Digital Care Hub, and we're really delighted to be hosting this in partnership with the Home Care Association. Oh crikey, got to get my screens all sorted now. 2 seconds. Okay. Um, Oh, crikey. Sorry, everyone. I'm just trying to actually move the slides forward, so just bear with me a second. There we go. Okay, so the webinar is being recorded and it will be shared afterwards. So if anyone wasn't able to make it, you can share it amongst them. We are in a webinar format, so you are on mute and you can't be seen. Please do ask questions in the question and answer function rather than the chat. We will try and answer these as we go through, and any that we can't answer during the session, we will send through the answers afterwards along with the slides and the recording. And as I said, you will get access to that. We've got a really exciting agenda. We're just going to whiz through welcome and introductions. I'm going to tell you a little bit about who we are at the Digital Care Hub. We're then going to hear from John from the Home Care Association. And then most of the session will be spent hearing some provider perspectives. So that's from Trudy from Belvie and TJ from Quality Healthcare Solutions. They will give us some really, really interesting insights into their application of AI within their organisations. And then finally, we are going to end hearing from Katie Thorne from the Digital Care Hub, a little around some key considerations and just touching on ethics. So really great session, and I'm going to whistle through quickly who we are in case you don't know. So we are the Digital Care Hub. We are a national not-for-profit supporting digitisation within the social care sector. And we are encouraging the social care sector to embrace digitisation, but really importantly, to do it safely. We do this via a whole raft of different ways. So guidance and support, helplines, case studies, newsletters, it's all on there. And we have really broad expertise. So in the data protection and cybersecurity field, across into AI and robotics, but also in things like funding opportunities, skills and training and resources. So if you haven't come across us before, do check out our website or get in touch with us. Our details will all be shared with you at the end. And it is without further ado, I'm going to pass over to John.
Oh, fantastic. Good afternoon, everyone. It's lovely to be here working alongside the Digital Care Hub to talk about AI in home care. And AI in home care is a really exciting topic. We'll get onto that very soon. So if we have the next slide, please. So the Home Care Association, we're the only membership body and are exclusively here to support home care providers in the UK. We represent and support organisations that deliver care and support to people in their own homes. And our mission is to ensure that everyone can live well at home and flourish within their communities. We champion high quality, sustainable home care services, and we support all of our members with expert guidance and resources. And we also work closely with government and stakeholders to help shape policy and practice. And I know times can get tough, but when times get tough in the sector, it's more important than ever to be part of your association. And together we're building a future where home care is valued, respected, and accessible to everyone who needs it. My name's John. My background is in running effective membership organisations, particularly in the health and social care space. And my focus at the Home Care Association is making sure that our organisation runs smoothly and strategically, supporting our mission through making sure there's strong governance, finance, membership, and corporate functions in the organisation. And I'm really passionate about building effective systems that enable great care and support to thrive. I'm really passionate about how AI can help us achieve even more, even better. So we'll move on to the next slide. So AI is really important in reshaping all industries, including home care. We're seeing rising demand, workforce pressures, and the need for efficiency, which is driving the sector to find smarter, more scalable solutions. And AI has the real potential to support us to deliver more personalised, proactive and preventative care. And AI can really support efficiency. It can automate admin tasks, optimize scheduling, and focus the time that we spend with clients. And AI tools can also enhance safety and quality. So, for example, through predictive analysis, fall detection, or medication reminders. And many providers are already using AI without realizing it. So, digital care records and smart devices just being a few of those things. But with lots of these benefits come many risks, including data privacy, bias, and the potential to erode the human touch that's really important in our sector. And that's why it's really important that we use AI safely, ethically, and transparently, and we really put people at the centre of our AI. So we're going to start off with a bit of a poll. So could we have the poll up, please?
Okay, hang on. We're putting my technical prowess to the test. Okay, so hopefully everybody can see that on their screen. If you can just take a minute to have a look at that and answer where you're at, it just gets us a little bit of an idea as to who we've got on the call.
Fantastic.
Okay.
And how are we getting on then?
Okay, so we can see it just slowing down on numbers. So can you see the answers your end? No, that's fine. That's fine. I was just going to say, so we've got a really great cross-section of attendees today. It's really nice to see. Most people sort of sitting somewhere in the middle around starting to use it, but wanting to start formalizing policies, maybe starting to consider particular options, or wanting to then develop what they already use further. Couple of terrified attendees as well. So hopefully we can pacify any major concerns and help you find a way forwards. So I will stop the poll now, and then we're going to come back to that at the end.
Fantastic. Could we have the next slide, please? So for anyone that answered, no, we're not really using it at the moment, I'm going to say you might want to think again, because often AI is used indirectly through staff using AI tools like ChatGPT or translation apps. Perhaps some of your scheduling software has got some predictive algorithms in it. Perhaps there's some voice assistants or smart devices in clients' homes. And all these tools are really helpful, but they can be risky if they're used without any oversight. So client data could potentially be shared, or decisions could be made without any transparency or accountability. So with my little introduction to the session, we'll move on to the next slide, and I'll do a quick intro to the specialist speakers that we've got here today with us. So Trudy, who's a social and entrepreneur and digital innovator in the home care sector. She leads Bellevue Care, which is known for self-managing teams and for tech-enabled care delivery. She's passionate about reimagining home care to be more person-centered and sustainable, and has a background, really interesting background in science and technology, bringing a unique perspective into care. We've then got JT, who's the founder and director of Quality Home Healthcare Services, Quality Healthcare Solutions, who's experienced in regulated care services and digital transformation. He advocates for practical provider-led approaches to adopting technology in care, and brings frontline experiences into the challenges and opportunities of AI in home care. And then once we've heard from Trudy and TJ, going to move on to Katie, who's the project manager from Digital Care Hub. She leads digital transformation support for care providers all across the UK. She's an expert in data protection, cybersecurity, and digital tools in social care. She has co-led national work on AI ethics and implementation in adult social care. She's a recognised speaker and advisor on smart tech use in the social care sector. So before we hand over to Trudy, just highlight again, if you've got questions that you'd like to ask, please do put them in the Q&A function, and then we'll get round to asking those at the end. So without any further ado, I'll hand over to you, Trudy.
Oh, thank you, John. That was a great introduction and a warm welcome. Thank you. And great to meet everybody who's joined us today. I was considering the title that was presented about using technology, using AI for and getting tips for smart and safe use. And I thought, well, yeah, we kind of are all in this place where we want to know, is AI our friend or is it a foe? So I'm going to show some examples of how we've used AI at Bellevue to help you form your own view of that. So in terms of me, my background is that I'm a former care worker. I'm also a former software developer, and I'm now the founder of a care provider. So probably a bit of a different background, being a coder and a care worker. And that's really allowed us to explore technology and see how it can help a sector which is quite frankly far more deserving of the advances that technology can offer these days. So I'm going to talk through a few examples. I'm going to start with one which has actually had the biggest impact on our time and productivity, and sorry about this, it's probably less relevant to your own organisations if you're from a care provider. But then I'll show a couple of examples which everybody can use, and then talk about one which is on our roadmap. So next slide, please, Fiona. So this is Nico. He is one of our developers. He's a great guy. And he is, he writes code, and software developers are quite expensive and not normally the sort of resource that a home care provider can afford. But we've made extra special use of Nico through his own ingenuity, in that he uses an AI code editor called Cursor. And how about this for productivity? It depends what task he's doing, but over the last 9 months, he estimates that his productivity has improved by 3-fold. So I get 3 Nicos for the price of 1, basically, because he is using AI, so it's generative AI, and it's generating lines of code. It's one built by developers for developers to use. And isn't that an amazing example of the sorts of levels of productivity that we can get? And it costs us, we have a team license, which I think is about $40 a month. Individual licenses are $20, and there are some bigger enterprise ones. So this is specifically for a developer to use, so may not be so useful, but is an indication of where this is going and how the future is going to change. So next example is, thank you, Fiona, is one that I should imagine most of you have used, and looking at the poll at the start, but ChatGPT, but maybe people are still trying to work out how best to and when to use it, etc. And I think that's really worth us, just people discussing and making sure, do you have policies about its use? Because whether you use it or not as an individual, there will definitely be other people in your organizations within the care sector who are using it. So here's an example of something I use ChatGTP for. Maybe it's because I'm not a copywriter. Maybe it was because it was 11 p.m. at night and my brain was giving up and I was overdue on a deadline to write an article about an electric vehicle pilot that we're running up in Northumberland. I was like, so I just asked ChatGTP if it could come up with a title for me. And it gave me some suggestions, informative and clear or engaging ones, short, catchy ones. And those are the sorts of things that it likes you to prompt as well. So if I don't like these titles, I don't like a paragraph it's written for me, I can say, can you try that again? But this time rewrite it for a formal board report instead of a web article, and it will give you some different suggestions. So it's all about knowing what questions to ask and you get the right stuff back. But remember, this content goes outside of your company onto ChatGPT's servers, and so no personal data. So this isn't one to be used for care plans, etc. But if it's content that you're going to put out there anyway, or content that you would willingly share to the outside world, then use it. So things I use it for, web articles are fine. Award entries, because I'm going to put that information out there anyway. And how many times have you written an entry for an award or something and you don't hit the word length? It's either way too short or way too long. Ask ChatGPT, it will, in front of your very eyes, get it right on the word length for you. Give it a load of bullet points and it'll turn it into paragraphs for you. So remember your facts and facts that you'd only have out there in the public domain, and ChatGPT is your friend. So the next slide, please, Fiona. This example is another one that anybody can use, and this is actually a tip from Nico, and I've been using it for a few months now. Nico has stopped using Google. You know how Google is now using AI to give you a search result at the top? And I was a bit worried because I saw some of our care workers sharing screenshots of something from Google AI, which I knew wasn't right. And that really concerned me. And I chatted to Nico and some of our leaders about it. And we're doing an education piece around what you can trust and can't trust. And that's how I found out about Perplexity AI. So if we are using AI to generate our search results for us, then actually the trick here is you want to check the references. And this is one of this is a really great site for using for search, because it will give you the answers you need like Google does, but everything is referenced. I'm showing off a bit here. The question I asked it was, which home care providers are using models of self-managing team? And I was so chuffed because everybody worldwide knows about Buurtzorg. They are the leaders in self-managing teams. And Bellevue, we came second in their list. How cool is that? But importantly, it's given little numbered references and links, so I can check every single one of those references in a way that's a little bit easier than the way Google AI does it. So maybe that's a tip you can take on and try using. So the next example, thank you. You'll see this is an example of some AI that we're using internally. So we've built, when you have a different model, our model of self-managing teams, it's a different way of working. It doesn't fit with off-the-shelf technology. So we've built our own care management system, rota, everything. And we thought, well, we've got all this information internally. How can we, what problems do we have? And we have coaches, and we have one of our coaches is called Dan, and Dan gets asked a lot of questions. Now, I'd like to have more Dans, but in the same way that I've managed to get 3 Nicos for the price of one, well, how do I get 3 Dans for the price of one? So we created this little chat tool, which we fed internal information. So it doesn't go out into the World Wide Web because we're not sure what it's going to find. So I'm being cautious about this. We've given it all our policies, our FAQs, and various other documents that we make available to our care teams. And it's indexed them. And it will generate, using AI, so generative AI, it will generate the answers to questions. And there's a couple of questions that come in quite regularly about holidays. And then one of the other coaches said about, oh, I don't know if people really, some of our new starters keep asking about safeguarding. And we've used it to test. And you know what? There was another really interesting side learning from this, which was some of the answers it gave us told us that we had some old content in one of our policy documents, because that was the answer that came back. So we found the policy, updated it, and now it generates the correct one. So we're using it to help with our annual policy audits as well. So I'll have to tell you in the future how many DANs it replicates, because this is all brand new and being piloted and tested right now. Well, on the next slide, you can see an example of what we've got in our roadmap. So we're strong believers in values-based recruitment, and we have built a personality and values survey called Team Fit. And here's an example of one of the results. It gives you this this graph which is the result we get in our admin interface, having sent out questionnaires to all our applicants and all our current staff members to ask them about their personality and survey. So it's very simple questions with images, really easy to use, and then we see this as the results. And there's some descriptions about what the technology has concluded about their agreeableness, low or high, conscientiousness, etc. And then the data for that one person is shown in the results. So now the next item on our roadmap later this year is to look at, well, how can we take the numeric results that are behind those graphs, plus the wordy descriptions, which come from the psychologists that we worked with to build this tool. And I can see some of the questions coming in. This is our in-house tool that we've built for our own use. We use it in recruitment, retention, personal development, team development. And AI is going to help us produce summaries of the results, so that as well as having the graph, you've got a paragraph which will help us in our recruitment and help individuals in their personal development. So so that came out of a challenge, because that was a problem that our users had internally, saying, how do we make good use of Team Fit? And they wanted the data presented in a different way. And so I'm quite excited about seeing how we can make our tools smarter and more effective as a result. And then the next slide is just a reminder. So next slide, please, Fiona. Is a reminder of, well, why are we using all these different tools? And it's not just using AI for the sake of AI. It's because actually we want to focus on why we're doing this. And that comes down to solving problems, real problems for real people. So that could be a problem that our back office teams face. It could be a problem that our care workers face. And it could be a problem that the people we support face. And we want to deliver better outcomes for our employees and the people we support. So how do we use technology to do that? We never forget, or our aim is to never forget the people who matter. And next slide, please. So to conclude, I hope, and answer that question, is AI our friend or foe? Well, I think I'm concluding that AI is here to stay. So maybe it's not about whether it's friend or foe. Maybe it's that family member that you're stuck with, whether you like them or not. But this is a new family member. It's joined the family quite new, and some people are a bit wary of it. But this new family member is still young and growing, and we have the choice to influence it through joining things like the Oxford University and Digital Social Care Ethics in AI group, which Belvisa signatored to and has some great information on the website, so do go and look that up. And we know that this new family member, the youngster, is going to grow up and be smarter than all of us, already is. But that doesn't mean that it's wiser than us. So how do we use its capabilities and work with it so that is to the benefit of us all? So ultimately using AI ethically. And I think for us, that's come from looking at real problems and solving real problems for real people. And recognizing that huge productivity gains are possible. And that's going to be key for all of us in the care sector. But it doesn't come without risk. So we use our wisdom and our common sense to harness the power of AI properly and sensibly. So think of the risks, make sure you have the policies, don't rush into it, and do it properly. And then we gain. And then hopefully it's a friendly, good relationship with our new family member. And that's it from me.
Thank you, Trudy. That was really brilliant. I've seen we have got quite a few questions coming in, but what we'll do is I will leave the others to answer those as we carry on talking with TJ. Trudy, if there's anything you can add, if there isn't anything we're able to answer right now, we'll make sure those answers get sent out when we share the slides and the recording. So without further ado, I'm going to welcome TJ to join us. Thank you, TJ.
Thank you, Fiona, and thank you, Trudy, for that presentation. So my name's Tajinder Baines. I'm a Director of Homecare Provisions based within the Havering Borough, alongside a few other roles. And I'm hoping that the next few slides will give you a bit of an insight into our journey around AI in the home care setting. So I guess it's undeniable the change that social care has seen around digital and the adoption of digital social care records, especially in the past 3 years, where the adoption has gone from around 30% to currently around 70%. And I guess there's growing interest on the back of that around how generative AI can support operationally and efficiencies, I guess, within the provisions. So it's natural, I guess, for the next phase of this journey to focus on how that wealth of data can be integrated with other systems through digital social care records, and additionally AI tools to make the most of it. Next slide, please. So I've gone with the engagement with the workforce as my sort of entry slide. And the reason for that is because I cannot express enough the importance of workforce engagement from my experience when you are looking at any form of tech change management or AI tools. So it's very important to get them on board from the outset. The difference between a successful and unsuccessful AI technology implementation often comes down to one critical element, in my view, and that is the human factor. So even the most sophisticated systems will only work when they're designed and implemented with human factors at their core. So with care being essentially built on trust, this must also extend to the technology care providers use. So building that confidence in a new system, demonstrating its reliability, relevance, and also alignment with your core vision and values is very important. And technology, I think, should also be viewed as something that enhances rather than replace the human care element. There's always a bit of a fear around that from your workforce team. So it's not about replacing people, but providing them with insights and evidence through data to support the decision-making process. And I equally think it's imperative for care providers to have a clear understanding of the human workforce workflow pressures and the cultural values, and ensuring that aligns with the technology provider so you deliver in harmony. Next slide, please. So on the outset, I think having a very clear timeline is imperative. It lays out the implementation pathway. This is a very similar, probably, experience to some of you that adopted the digital social care record. So think of it in a very similar sort of mindset when you're looking at AI tools as well. So look into the initial problem. What is that you're trying to solve? And also, what is the perceived value that the adoption of AI will deliver? Equally, research the various AI models and the software providers. And you can do this through the Care shows, the Rewired show, or the iTech show. And I've put down here that the adoption of AI is probably happening by chance or choice. And what I mean by that is by chance, if your digital social care record provider drums up a new functionality and you have it up and running, or by choice, if you are approaching AI software providers and going out of your way to see if they can integrate with your system through potentially an API key. In either case, it's pivotal that you get a demo for yourself and the wider team around that AI tech, gain some of that feedback from the stakeholders, and incorporate the appropriate training model to best support the office team, the frontline team, and even possibly the person receiving the care if there's some functionality and outputs on that side. Setting a clear date, timeline, implementation date, rollout date, it just helps build some of that excitement and also keep people, I guess, clear on that journey and that progression. Next slide, please. So the Gen AI I offer in my personal services, I just want to highlight firstly that over the past 7 years, I have worked with various projects across the sector in a consultancy capacity, ranging from remote monitoring, there was Homecare, technology-enabled care, currently looking at sensors and voice-activated devices. But for the purpose of this presentation, I'm just going to focus on my services and the recent AI advancements. So I also want to clarify that I'm not endorsing or advocating the use of the PASS system. They are my software provider of choice as a digital social care record. And initially in May, they had early access to their AI function, PASS Genius, and it's promised to deliver clearer insights, support the faster decision making, reduce admin time, and also AI care note summaries. This all sounds very promising and great on paper, but what we'll do is we'll have a deeper dive and see how this actually translates into the daily care provisions. And for the purpose of this presentation, just to let you know that the next few slides is based on demo data sets, but the insights and feedback will be from the actual users in my team and my office. So firstly, we were provided with a capacity management tool. This essentially looks at the carer's availability. So whether you're doing drop-in services, 24-hour live-in, it will map out in a green across all the way to the red, which is very low availability, the days, the times throughout the whole day, so that you can start identifying patterns where you need to boost potentially your recruitment criteria. And I just want to highlight the information data is only as good as what you're putting into the system. So I know it's quite frustrating as a home care provider when carers quite regularly change their availability. So just to put that in there, that this information is only as good as what you put into the system. Next slide, please. Pending hours. This helps look at particular times throughout the whole week where particular customers may not have their visits covered as well as they are required. There's also a function for drop down, so you can drill it down per customer. But again, another mapping tool that helps you at a very quick snapshot work out where you might need to recruit, what days and what time slots you need more staff to be based. Next slide, please. Travel time. This was another sort of widget on the dashboard, which can help you drill down into what carers are spending the longest and the shortest time in terms of traveling from customer to customer, client to client. Equally, this can be drilled down into per carer and also the most and the least travel time. And it can help you potentially look at and really drill down into that journey. And is it the most effective? Is it the most efficient? And it just gets that conversation going as well. Next slide, please. So punctuality, this is very helpful. And again, it does drill down into per employee level. So this will help identify trends around any visits that are understayed, overstayed, late. So you can have that constructive conversation with your staff team And at a very quick snapshot, this is a rolling updated data set. Again, another tool where you can improve your quality of service delivered. Next slide, please. So this is something I actually had a discussion with the director of PASS around sort of 2 years ago, because I was very passionate about the fact that, from a care service delivery point of view, the large language model can pick up and analyze vast quantities of text, and the daily log notes is a fundamentally prime target to be assessed under that model. And go forward in time, and we're now at a point where the offering, as per this slide, has been presented to the market. So it offers to look at every single word on every single daily log note produced, and it will review it and try to work out key points, themes, risks, missed visits, actions that might be required. And it's just important to highlight, it's not about replacing the human element or judgment. In fact, that's pivotal in this, and I'll touch upon that a bit later again. But it's essentially adopting the technology to look at smart recommendations and follow-up actions, and also identify patterns which otherwise may have been missed. Next slide, please. So this, just for an example, is what that care summary may look like. So you can specify, I'm assuming most of the providers in the call will be doing audits on daily log notes in some capacity, weekly, monthly, quarterly basis. So you can specify a time period, and from that, you will get some significant information. There may be a change in medication dosage. There may be visits that are being cancelled, and there may even be a new condition that develops. The system will then pull that information together and also produce recommendations about the next steps. So proactively looking at engaging with the care provider to take steps and intervene at an earlier stage. And so, yeah, at the bottom there, you've got some examples of how that intervention could work. Making referrals to the GP, looking into that new cough that's developing if it persists, and also reasons for any calls that are being cancelled. Is there an underlying issue behind that? And it also picks up on things such as if there's a boiler leak in the kitchen that's not working, and the next of kin has advised they'd be looking into that. So quite in depth. Next slide, please. So from our experience, we've seen very useful widgets on our dashboard showing real-time oversights. We've seen some immediate improvement in terms of the efficiency, being able to really have those meaningful conversations based on the data insights. And also looking at the past, the present, and having a view on the future outcomes is, I think, very powerful and plays quite nicely into that government agenda of 3 key shifts, keeping people from hospital to home and from treatment to preventative care, as well as anticipating future needs. Next slide, please. Feedback. So from my office team, this is some of the feedback that's been currently presented, bearing in mind it's still a relatively new tool that's been made available to us, but they are very much in favor of that dashboard and that snapshot. Sort of, they can really drill down into each widget, as well as a summaries being provided, and now they can really start looking at some of that travel time and journey to make some real efficiency changes where possible. Punctuality is also, you can pick up on visits and some common themes around any lateness, and the reasons behind that can be explored. And yeah, the fantastic care note summaries are proving a success with the team to provide a very quick and, as far as we can tell, a very accurate snapshot so far on changes in health conditions. Next slide, please. I couldn't have presented these sets of slides without discussing also the potential risks with AI, because it wouldn't be balanced and it wouldn't be a fair reflection of the reality when you're taking on any new technology, including AI. So as a word of caution, for example, care plans, I would probably stay away from the AI producing those at this stage. From my personal experience, it's a very collaborative approach. and it may disempower the care receiver, leading to loss of trust. So there may be a scenario where you have to really think carefully where it's appropriate and perhaps where it's not. And I've also put on there that the human in the loop is absolutely vital as the data controller. Sometimes there's complex family dynamics and emotional nuances, so that might get overlooked by the AI. And we also know it has hallucinations and may bring up information which is correct. So important to keep someone from a human experience in that loop. And at the bottom, they've just put a quote from one of my colleagues from the marketplace around, the care record. The care plan, sorry, is a record. It's a conversation, it's a relationship, it's a commitment, and it's a very sensitive document. Next slide, please. So in terms of a conclusion, it's early stages for us, but we have seen some sort of initial potential improvements in our support to the people in the community. We've been able, I guess, to pick up on some early interventions, and equally, I think it's important for as a care provider to identify your priorities and what are the key challenges, because ultimately it's not only about the end AI tech, but how and who has joined you on that journey. So I would encourage care providers to engage with your workforce. Also equally engage and collaborate with the software providers and the digital social care record provider. They often have workshops and need input in their development process. Creating a timeline, providing the appropriate training and that continuous feedback. Don't accept things if they don't deliver the value that you perceive they should, and they potentially have the ability to do so. Human in the loop, once again, is very important. And equally, I also wanted to mention the opportunity for the improvement of staff morale in terms of retention as well. Because when teams are equipped with the right tools, they feel more confident, empowered, and more capable, and also connected in their roles. So I think by automating time-consuming administrative tasks, rota planning, care documentation, compliance, auditing, this through the AI-powered digital systems can free up valuable time for the workforce, allowing them to focus on what truly matters around spending time with the people they support. I think innovation is enabling early intervention and more accurate monitoring for greater independence, and also supporting that maintenance of routines for people to enjoy better lives. Next slide, please. And I also think it's a very important point to raise around the guidance of AI in terms of ethical use in the social care setting. And I just want to compliment the work Digital Care Hub, Katie, which will probably be touching on this a little later today, and Dr. Green has done around this ethical work. Please do look into this. There is framework, there's around 12 categories, and there are we statements for providers to consider and adopt to ensure that they are not in breach of the fundamental values. So this slide just captures that point. Next slide, please. And then there's some resources for you, which we'll be sharing in due course. And I think that concludes my presentation. Thank you for listening.
Thank you, TJ. Another really, really useful presentation there. Really great to see insights into how you've implemented AI in your organisation. There have been loads of questions and thoughts flying around on the chat. So I will leave you maybe if you're able to respond to any of those. And then, as I said, if we've got time at the end, we might just pick up some key points to discuss in the Q&A section. Thank you, TJ. So our final sort of formal slot, I'm going to hand over to Katie Thorne from the Digital Care Hub to talk about ethics and responsible use of AI.
Thanks, Fiona, and thanks, everybody. I feel this slot's being queued up quite well by all of the previous speakers, so hopefully that's really helpful. I am going to be really brief on this one. I'm very mindful of time. There's a lot more detail we can go into, and we probably will do some follow-up webinars as well. I know there's a lot around data privacy in the chat, so probably one for us to pick up if it doesn't get covered in the time today. So I just wanted to let you all know about a project that's been happening since the tail end of 2023 now, which we've been working on at Digital Care Hub with the Institute of Ethics and AI at Oxford University and Casson Consulting and organisations from across the social care sector. And we've been really looking at what the responsible use of, in the first instance, generative AI would be for social care, though it has broadened out to sort of wider artificial intelligence following that. We are still actively working in this space and are always looking to work with more people. So while this is very much a whistle-stop tour, please do get involved, do get in touch. We're moving into phase 2 now, so work is definitely still actively happening. So we have been working since December sort of 2023. I got to meet with Dr. Caroline Green, who is a phenomenal researcher and a human rights lawyer with a background, especially in adult social care. And we started talking about ChatGPT in particular because we started getting calls to our helpline at the Digital Care Hub from frontline care workers, mainly asking if they were allowed to use ChatGPT for various things. And it became really, really clear that we needed to get some guidance quite rapidly together about this. So in the February 2024, we then hosted a roundtable to bring together about 30 organisations from across the social care sector and Homecare Association. And one of those that we're very, very pleased with there, and I believe Trudy was also actually at the initial roundtable as well, to talk about the potential benefits, the challenges, the risks, and what we needed to do about it. And off the back of that, we committed to all continue to work together initially for 6 months and then for 12 months. We then, as part of that, developed a steering committee, which was open to anybody to join and does continue. If you are very interested in the space, you're very welcome to join. Please do get in touch. And then we split into different working groups. So we had a working group of people with lived experience, actually multiple lived experience working groups, all different sort of age and demographies. We partnered with a care workers charity to work with frontline care and support workers, work with care providers, commissioners, technology industry, and also academia, who I've managed to miss off that list, despite the fact Oxford University is at the top of the slide. We produced lots and lots of different pieces of guidance. So there is a statement from the care workers charity, Think Local, Act Personal have published their own guidance from people with a living experience perspective. And then we came together to sort of co-produce AI guidance. And this is the definition that we came up with in terms of what the responsible use of generative AI in social care means, really founding it in sort of fundamentals of human rights and the core values of care. Next slide then, please, Fiona. And we also have published our co-produced guidance. It's set out in a series of I and we statements, if you're familiar with Making It Real, which then forms the foundation of the single assessment framework. We followed the same format. So we have I statements for people who are drawing on care and support and people who are working in social care. So that might be care and support workers, but it also covers administrative teams, operations, directors, senior leaders, nurses, social workers, and occupational therapists. And we're working quite closely with a variety of different regulatory bodies as well in this. And then there's the we statements, which are for providers of care. I appreciate that's clunky wording, but it's because it's for both care homes and home care, supported living, but also for commissioners as well. And also we statements for technology providers. I'm not going to go through the whole thing because it's quite big as a framework, obviously, but you don't need to look at every single aspect of it. It's sort of broken down dependent on your role and the view in which you're taking. And I believe the QR code does work, so you should be able to see that directly. There are 12 domains to the guidance framework. So some of these I think you'd very much expect to see. So we have information around data privacy, transparency and accountability. Training, that's around staff training and training people you support, not around training AI models and algorithms. We're not trying to create our own large language models. Information and guidance around sort of co-production and how you can do that in a meaningful way when we're talking about artificial intelligence. I think most of these are fairly self-explanatory as titles. The one I will touch on briefly is sustainable technologies. The thing we haven't got in the guidance yet, and is definitely our next steps, is looking at the environmental impact of artificial intelligence, which can be quite negative. In this instance, what we mean by sustainable technologies is if you are investing in something which is startup and quite new, what are your risks involved in using a company which might not be there next year, for example, and what does that mean for the care that you're providing? So is it sustainable in terms of your service and your organization and approach, not sustainable in terms of your carbon credentials? We will come to that later. But we know that this is very much sort of the first phase of all of this work. We are actively collecting best practice use cases of AI and are sharing these all of the time. And we've also published a collaborative call to action, which is open to anybody to sign up to. We ask that people use the guidance, obviously, and that we continue to work collaboratively as a sector about responsible use of AI. But more specifically, we're calling on the UK governments, because we've been working collaboratively with Scotland, Wales, and Northern Ireland as well, and the UK regulators to produce clear guidelines and frameworks for us to be using to make sure we're safeguarding people while still getting the benefits of some of this technology. We've heard of some of the incredible benefits that can happen, but there are obviously risks with any kind of emerging tech. We haven't finished this piece of work. As I said, it's ongoing. We had a summit in March of this year where we launched all of this guidance, got to bring people together in Oxford, which was absolutely lovely. But we know that there is more to be done. So we have also launched in Oxford that we'll be doing an AI and Social Care Alliance, which is open to anybody across the social care sector who would like to be involved. And there is lots of information on our website about how to get in touch about that. We literally had our first steering committee meeting of the new alliance this morning. It's been a busy day for me, but really lovely to hear from all of you. And as I said, if it's helpful to go into more detail, either in questions or afterwards, please do let me know. I think that's it for me. Yeah, thank you.
Thank you, Katie. I'm wondering if we just pick up any sort of tail end questions now, or if there's anything that you wanted to pick up on particularly, Katie. I noticed there was one in the Q&A that you said you'd like to answer live about which base platform do you use for LLM chat.
It was just so people could see it. That I think is actually for Trudy. She wants to know which base platform you were using for.
Oh, there was one about what tech we're using. So we haven't bought in tech. It's not off the shelf. We've built our own. For those that do want to know, we code in React, and then our app is React Native, and we use a lot of Amazon Web Services products. That's where it's hosted. We don't provide our tech as one of the big tech providers, but we do partner with in the last year we started to partner with a small number of care providers where they can see that something we're using might be useful for them, and that's really quite interesting. It also means we both benefit because there's more data in the system, so we learn and improve more. So if people are interested, there are a couple of comments, then just reach out on LinkedIn or wherever and we can chat. But yeah, we haven't bought it in.
Thank you, Trudy. I'm just picking up another one. Do you use tools like N8N or Gumloop for AI workflows, or are there better ones? It's like a foreign language to me, I'm sorry.
Oh, yeah, we're not using either of those two currently, but they do look they look fascinating. I have looked a little bit at Gumloop, and I know somebody who has used it outside of the care sector in a no-code solution and is appreciating it, but I don't have first-hand experience. I don't know if TJ or Katie or anyone does.
Anybody wanting to come in there, TJ? I'm not sure if they're...
Yeah, equally, this is something I'm exploring currently, but not something that's adopted in my service at this stage.
Perfect.
And I think technically Trudy's a little bit different in her setup than I am. I've kind of gone for a off-the-shelf product. And yeah, not quite as adverse in terms of development and coding as such.
And that is what I would advise other people to do, TJ. I've spent 17 years in IT, so we're in a slightly different place. But if you buying off the shelf is cheaper, so if you can, you should always do that. Let someone else have the risk of owning and maintaining that technology. We had some different criteria that we needed to fulfill, and the tech didn't exist, so we had to build it ourselves. But don't do that if you don't have to. It's really not the route I would advise anyone to go to.
Thank you, Trudy. And TJ, there's another one here for you. Do you use the AI in Pass for the care note audits? You may have already answered this one.
Yeah, sure. So currently the answer to that is no, but it is on my wish list where I work quite closely and collaboratively with the Pass system and the director and the development team. They have a very long pipeline of ideas and concepts they're exploring. So ultimately, for me, I'm looking at efficiencies, time saving, operational tasks, and audits is a massive one. Um, we're just clarifying the criteria that will be used to quantify what is a good daily log note look like versus a poor one. So there is work being done at the moment around that. And I think naturally that might be the next evolution in that sort of process and that large language model analysis. So watch this space, but currently at the moment, we're just having summaries based on a month's worth of activity, for example. But there's definitely some capacity there and capability to do some of that auditing, which I'm really pushing hard on to save my precious team some time where possible.
Thank you, TJ. I think what we're going to do there is just hold fire on questions now. As I've said, we will go through all of the questions that have been submitted in the chat and make sure that we've answered all of them, that we share any of the useful resources or comments that have gone in the chat so that you've got those sort of as a resource pack for afterwards. Katie has also just sent a message in the chat to just say her email address on this slide is incorrect. So if you're wanting Katie, look in the chat because her email address has been updated since these slides. So before we wrap up, I'm just picked up a sort of a few key points really as we were going through. And I think it's useful just to take away, this is very much the beginning of a long journey. We're in the infancy of AI, but it is coming really rapidly. We are seeing it everywhere. Embrace it, use it, and take the benefits. But I think very, very key is where appropriate. I think somebody put in the chat, and I really like this phrase, AI forward, not AI first. And I think that feels like a really nice balance of using that. Understanding, managing the risk like we do in every other aspect of our work within social care. Consider the security, consider the ethics, use the resources that are out there. It can be really hard when we're not techie. I'm certainly not from that background and it feels quite overwhelming, but use that support that's there. And if in doubt, just be a bit cautious on that respect. I know I've been chatting to Katie previously. This is very much the beginning of these sorts of webinars. We will be looking at doing some further ones that maybe drill down into that in a little bit more detail. This is sort of starting the conversation. And if you think there's things that you specifically want to be covered, then please do, get in touch with us. We can sort of develop whatever you guys need, really. So we want to make sure that it's hitting your requirements. But I think the other thing is just, making sure you've got policy in place, you've got strong culture across your staff body, and you've got education within your team so they know what to use, what not to use, what they can trust, what not to trust. It's so, so important. There's lots out there. So before we finish, I'm just going to put up another poll and just see where everyone's at. Oh, okay. Let me that is the results from the first one. Let me see if I can get to there we go. I'm going to launch an end poll just to see where everyone's at. If you can answer where you are, that would be really, really helpful just to sort of see what position people are in, sort of following the webinar, really. Great. So, I mean, it's looking like people are wanting to move forwards, but actually it's about focusing now on policies and ethics and staff culture. So that's really great to see that, that's sort of where everyone's at. And a few people still sort of not quite sure where to start, but hopefully this has given you a good taster of where to go. So I am going to end the session now. Really, thank you very much for coming. Thank you so much to all our speakers, and we will send all our resources to you over the next couple of days. I'll just pop that up on the screen in case you want to get hold of us at the Digital Care Hub. Thank you so much, everybody.